All right. Hello, everyone, and welcome to the Babies in Common show. I'm Jeanette.
And I'm Melissa. And today is June 17th, 2020, and we will be discussing birth as a physical, emotional, and spiritual journey.
And our special guest today is our dear friend, Dina Shea-Fraize of Central Mass Midwifery Services. And she's been serving birthing families in Central Massachusetts for many years, starting as a La Leche League leader and breastfeeding counselor in 1998, and then as a birth doula in 2001. She completed her midwifery education program with Womencraft Midwifery in Amherst, Massachusetts, and began attending home births as an apprentice in 2007. And in 2009, she opened Central Mass Midwifery and began to take clients under supervision. And then in 2012, she sat for and passed the national exam and the requirements to become a certified professional midwife. She's been practicing home birth care in Massachusetts ever since, and we're so lucky that she is. She's also, on a personal note, raised 5 incredible young men. I have met them, they really are, and loves spending time with her family, being by the ocean as much as possible, and immersing herself amongst the flowers, herbs, and veggies in her gorgeous garden. And she lives with her family in Worcester County. So thank you for joining us today, Dina.
Thanks for having me.
Yeah.
Yes, thank you so much. It's funny because I actually met you back at Jeanette's old business, Mothers and Company, right at the cusp from when you were going from doula to home birth midwife. So it's so far like how far we've come as friends and professionals, and how we've expanded our expertise and everything. It's great. So today our episode is called Birth as a Physical, Emotional, and Spiritual Journey. And that was a title that you helped us come up with because you often write on your, people follow you on Facebook, Central Mass Midwifery. You write so eloquently about these birth experiences, with permission, of course, that you have with your home birth families that you take care of. And you interweave all of these themes in the writing that you do about these stories. It's really, really awesome to read. So let's start with physical. Many who are listening to this podcast have studied the anatomy and physiology of labor and birth, either because they are expecting and they took a childbirth class, or maybe they are themselves a birth professional. But I don't think that's what you mean when you talk about physical journey. So when you describe birth as a physical journey, what do you mean by that?
I think I mean some of what you're talking about, right? So the physical journey is your body actually opening, right? So your physical journey is one of growing this person and then allowing your body to open and bring this person here. So physical can entail, right? It's all of the learning, right? It's the childbirth ed. It's how does this work? It's what is my body doing? Getting all of the information gathering that you need. And that's different for different people. It is the physical, making sure you're safe, right? It's the listening to your baby's heartbeat during labor and at prenatals. It's the vital signs and blood pressures and all of that kind of stuff that we do. So one of the things that I don't want this podcast to end up veering into is that we don't do any of those things, right? So, and home birth, we do all of those things. We do all of the clinical things, and we make sure you're really educated. So I see my sort of role in that as providing information, right? Referrals to other places so that you can be aware of what your physical body is going to do. Because the more you understand what your body's doing, the less fear you have about allowing that process to happen. Does that make sense?
Yeah, and that's actually research-based. There have been lots of research studies in the world of childbirth education that say, different than what people might assume, that learning about the process of labor and birth, even things that are not necessarily pleasant to learn about. For example, what a perineal tear might actually be like, to experience that or to have that healed for you. We talk about that in childbirth class. That's a part of the labor and birth experience for many birthing people, not all, but many. And it's not necessarily a pleasant topic to talk about, but when you talk about it, but it's really like reality, not just fear-based, the story I heard of the worst case scenario, right? Or you talk about ways in which you can lower your risk for something like that to happen, or support the perineum to open and stretch around your baby. It actually decreases your fear. So a lot of people I hear oh, I don't need to take childbirth ed. It's just going to make me more nervous. That's what a lot of people say, but really that's not what the research says. That's not my experience as a childbirth educator. I'm sure you agree, Jeanette, that that learning about what is actually physically happening in your body, as lowers your fear about the experience, and that's important because fear can really throw a wrench in the works when it comes to the labor and birth. What do you think, Jeanette?
Well, I also feel like people come to labor if they didn't take a class or read some good books and watch some good videos. They come to class feeling like, well, I'm just going to get there and get in bed, and then the doctor will tell me what to do. And at some point, I'll push. And there's not really a good knowledge. I mean, some people that come to childbirth classes over the years seem to feel like, oh, yeah, no, I want to move around as much as possible. I want to learn about this. But then a lot of people are like, well, what do you mean I'm going to move around? What do you mean I'm going to have hours and hours of this? And so it is very physical. And some people, including me, think of it as sort of similar in a way to a marathon of there's a lot of work to be done and there's ebbs and flows to it. Not that I've run a marathon, so maybe I shouldn't use that analogy all the time. But the idea that you're in for the long haul for most people, and it's not all a negative thing. As a former runner, not marathon runner, but at least a runner, I can speak to. You get started, and it might be a little bit hard, and you might be thinking, oh, I don't know if I want to do this today, or I don't know how much energy I have today. And then you get to that runner's high, and you're like, oh, I can totally do that. And the two labors that I experienced, and being with many people in labor as well, you see that where, they get to a place where they're like, no, I got this. Okay. But it ebbs and
rhythm
flow.
To it.
And it ebbs and flow in difficulty as well, and the challenges that come up. And if people don't know that, or if scary things come up and they didn't know about it beforehand, it might be even that much more scary. And then you get into the physical aspect of the hormonal response that you have, where you get that adrenaline rush and you're even more afraid. And that messes with the hormonal cascade of positive laboring hormones. So, yeah. So physicality.
And the physical things like, a lot of doula support is physical, right? So a lot of the rebozo, a lot of the spitting babies, a lot will use, when necessary at birth, or in, prenatally. Those are all like the physical aspect of it, right? It's how are we going to help this baby, right, get in a really great position and help this mom allow her body to open. Like those are the physical components, right? We forget about the baby in the process. And babies are super active in this process, and most people don't. So when I say to people, do you know what position the baby's in? They say head down.
Right.
I'm like, oh, no. Do you know where the back of the baby is? So it's there's a lot to the physical component. And I think there's a lot of differences between hospital providers and midwifery care, and then home birth midwifery care, even a little bit further over. It's a different sort of care.
So let's talk a little bit more about the physical sensations of labor and birth, because I always joke in childbirth class, they call it labor because labor is hard work, and if it was easy, they'd call it picnic, but it's not a picnic, right? So, I mean, and some people disagree with me. I've gotten into some heated discussions with some hypnobirthing practitioners in the past about how, they prefer not to use the word pain to describe the sensations that you feel in labor. And I actually fully respect that, because not everybody feels labor the same way. But for me, I can only speak personally. For me, it was painful. Like I had many, many, many hours of unmedicated labor with all three of my babies. And I did have a completely unmedicated home birth with my third. And funny story, I was teaching childbirth class, and I often have aspiring childbirth educators shadow me, because part of the certifying process is to see many different types of classes, right? So there's this one provider who was certifying in like a mindfulness based, pregnancy labor preparation approach, and I was joking with participants in class about how I felt during the crowning part of my home birth. I'm dying. I'm gonna die, because at that time I literally felt like there was a freight train coming through my whole body. Not that I was pushing a freight train out of my vagina. I don't mean that. I mean that like my body there was a freight train going through my body, and every muscle, every intercostal muscle in my ribs, my core muscles, my stomach, my legs, my pelvic floor just felt like there was this freight train coming through, right? The power, the intensity of birthing a human being, right? And so I yelled, like, I'm gonna die. And what's funny is the midwives were like, you're not gonna die. And like, I was like, I'm gonna die. And I looked at Paul, my husband, I'm like, I'm actually gonna die. He was like, what's that? He looks at the midwife, he's like, she gonna die? And they're like, she's not gonna die. Right? Like, and then he was out. I mean, she was out, right? I mean, it was that moment at crowning. And many people have had that experience, but I don't sugarcoat it for people. To me, there was some very painful and intense moments of labor and birth. And what's funny is, so in this class, this particular, I was telling this to the participants, they were all laughing, and she goes, really, for your third, it's still painful? I'm like, yeah. Like, I was still pushing a human being out of my body. Like, I don't know. I mean, I know for some people, maybe it's not, but for me it was. And
but it doesn't get progressively easier either. It's not like, oh, you're having your 8th baby? Oh my gosh, you're not even going to feel it. Like, that's not how the body works.
Wake up and it's going to be in the bed, like, no, you're still pushing human being out of your body. Granted, my first labor was 36 hours, my second was 17, my third was 12, right? So like, certainly my body got more efficient at it. But to me, labor is a physical, but it's not comfortable. And here's the thing, right? Labor pain is different than any other pain you've ever felt in your whole life. Can you speak to why that is, Dina? Because like I said, you might not describe labor as painful, but many people do. Many people say that labor was hard work and it was painful, but it's not the same thing as other types of pain. Why is that?
I mean, I think that I don't sugarcoat things either. For most people, I rarely see someone do what they show on natural birth videos. So I have this like beef with the natural birth video world right now. So I'll get on my soapbox for a few minutes. They're not showing birth. They're still not showing birth, right? They're showing edited versions. They're showing what people are willing to put out there. They're not
like photo montages with nice music.
Yep. They're not showing people yelling, I'm going to die. They're not showing people, pooping and peeing and the primal state that most women go through to bring babies here. It's not a smooth, at twilight with a particular track song playing while most people push their babies out in a birth pool of water lilies. That's really rare. I think I might have seen it a couple of times for like 6 babies or something.
I think I love that's the title of your book.
What?
Birthing Pool of Water Lilies.
Colon, what not to expect in your home birth experience.
Yes. It's not a birthing pool of water lilies. That's the name of it.
For some people, that is true. I do have a couple of clients who do that. But I will tell everyone out there, most of those videos are edited because birth is a raw, primal, powerful state that women are in. And I think that the natural birth community posting all of these not real videos are still making women feel incredibly self-conscious about what they do in birth. And I hear women apologize for swearing. I hear women saying that they're so sorry they were so loud, all of that stuff. And so I think we're still not holding and honoring that women are powerful, right? We're still tamping that down.
I think it also depends too on what families have seen, because I know I haven't seen every video in the world, but we've seen more amongst the three of us than generally parents to be might. And the videos that I would show in a prenatal education class have evolved over the years. And now I feel like they're pretty raw, but given that some of the things you said, I've never seen a film of like, oh, here's what she looks like and she's pooping. Oh, I would love there to be a video of somebody doing more on a toilet. We have one a little bit, but it's just there's so much that there's raw and it's not always there. But the videos that at least some of us are showing in prenatal education are as raw as we can find them. That's still kind of shocking to the system of someone who's newly pregnant, who's pregnant with their first baby. you know?
And
So
a lot of people are getting on YouTube and,
right.
you know, looking at them, and sometimes progressively, like, you know, allowing themselves to see
right.
more.
And then there's that, like, I'm not going to say the name of it because I don't like it, but there is a place on Facebook where there are videos where people live stream their births, and I got tired of being part of that, so I left that group. But
I agree.
yeah.
But yeah, I mean, I think that, so what was your original question? I sort of went off on a tangent, sorry.
No, we were just talking about how birth is a physical journey. Like, you know, bringing a human being from inside of your body to outside of your body, however that happens, even if it's a surgical birth, is a physical journey, right?
Yeah.
And I mean, even pregnancy is a physical journey, right? You know, and we talk about this when, you know, there's different experiences of being an expectant parent if you're the pregnant person or the non-pregnant expectant parent, right? The pregnant person often feels bonding towards the baby sooner because they're feeling those little flutters, those little kicks, the moving. They're starting to form this relationship with, if I push here, the baby pushes back, or, you know, whatnot. And that's a journey, right? Because, I mean, I remember, I can speak personally, I had 3 miscarriages before I conceived my son, Pierce, and a long infertility struggle. And I didn't even want to really get my hopes up when it came to being pregnant, even though things were going very well. And especially being a labor and delivery nurse, I worked high risk obstetrics for 3 years. I saw what it was really like to have a 24-weeker get delivered, right? Like, that was not something that, you know, people who aren't in the world of high risk obstetrics think like if you can make it to viability, like it's going to be okay. And in many situations, it's really still, you know, pretty hard for those babies. So I didn't even want to like think about that, you know. And it wasn't really until like 28 weeks where I started to allow myself to be like, wow, okay, I'm actually going to bring a baby home here. And so I had closed myself off so much to that physical journey of pregnancy with my first in the beginning, that when I got pregnant with my second, like I really just opened up myself, my heart, to allow, you know, however this pregnancy was going to go, to just go. And it was a completely different experience, being able to just allow myself to bond and feel pregnant, right? You often feel more pregnant the second time around to earlier because, you know, and it was just a completely different experience. So can you talk a little bit about that? Like, you know, how is pregnancy a physical journey?
You know, it's really different for different people. So I hear women, again, come in my office and tell me, so we all carry, you know, I don't want to say trauma, but we all carry different levels of experiences that we've had in our lifetimes. So I'm really lucky because as a home birth midwife, I get to know my clients really, really well, which is really nice. Like, part of why I do this is that relationship. I think that's so important. So some women feel really connected from the get-go. They are really attached to this baby. They feel very connected, and other women don't. And then they feel bad about it. They feel like they're supposed to, right? It's sort of like, I'm supposed to want to reach down and catch my baby. I'm supposed to want that baby to go in my chest. I'm supposed to fall in love with this baby. I'm supposed to love being pregnant. And everyone walks up to me and says, oh, you're pregnant. And I'm like, ugh. You know, there are women who really want to have a baby but hate being pregnant. And that's okay. Like,
that is so okay. Being pregnant is not fun and games for everybody. And I feel like I, as a labor and delivery nurse, like, appreciate that to a big degree, because some people have really, really hard pregnancies, hyperemesis, they get, you know, cholestasis, pups rash all over their body, their legs are swollen, they can't move their joint. I had quite a few I mean, I've been doing this for a long time, but like women who had their pubic symphysis was so unstable that they had to walk with a walker like, during their pregnancy. Like, man, nobody should make you feel bad about hating that.
And so I think it's really different. That connection piece for everybody comes at different points. And the physical act of being pregnant can feel really joyful or really frustrating, you know, for people. So I think it's just, it's really different for everyone. Does that answer the question? I keep feeling
Absolutely.
like I'm your question.
No, the one other thing that I think I would love for you to describe, just with a bunch of adjectives and activities of like, what are you seeing in the real true, there's no pain medication available, I'm a home birth midwife, this is what I'm seeing and hearing my clients talk about and what they look like and what they're doing with their bodies and what they sound like. Like, what does birth look like and sound like from a physical point of view from what you're seeing? Like, what's the spectrum?
Oh, like one end to the other?
Sure.
Yeah.
Because everyone's so different. Again, it's so hard to quantify. You know, I have someone who does look like she's meditating through her entire labor. She gets up, she gets in the tub, and she pushes her baby out with like the TV on and the kids running around, right? And then I have people roar their babies out, you know, just roar through it. And that's okay. Like, there's so many different ways to do this. So I think it's hard to quantify, you know. I mean, I see almost 100% natural birth, right? So my basis of what I see is so different from what you see in the hospital, right? So the hospital providers rarely see natural birth. It's hard for them to see it. So their basis of understanding birth is very different.
It's hard for them to see it because it happens less in hospitals by definition, but also because even if there is an unmedicated natural birth happening, they're very unlikely to catch more of it than a few minutes here or there or right at the end, because they have other places to be and other people to see, because that's part of their job. It's not because they're being mean, but it's just a very different experience, you know?
Yep, it's just a very different system setup. So, I mean, I don't want to sort of talk about the logistics of home birth because I think someone else is going to do that, and I don't want to get that case. You know, there are some really simple, really different things, right? Women at home, their babies' heads are born, and then we wait for the next contraction. So in the hospital, they pretty much, and I hate to say it this way, but pull the baby out once the baby's head is out.
Oh, they do. I'm
trying to be really sweet about it.
No, so that's called active management of second stage, right? So this is not something that you are just editorializing and trying. If you look at obstetrical textbooks that teach a medical interventionist model of care that are under the philosophy that pregnancy is something that needs to be labor and pregnancy needs to be actively managed in order to avoid extreme devastation for, you know, mother and baby. That's called active management of the second stage. It's also active management of the third stage. We're essentially trying to pull the placenta out instead of letting it deliver on its own. So you're not bad mouthing it. I mean, that's people lecture on that. I mean, that's something that is taught, right? Yep. So head is born at home birth.
Mm-hmm. We wait for the baby to work, right? So we wait for the next contraction because the baby's working. We see babies turn this way, we see them turn back that way, we see them wiggling, because they're working to move their shoulders in the way that they need to. So it's just a really different process at home physically than it is in the hospital. It's just a really different process.
And the other thing I'll say too, as far as, you know, can you have a successful, positive, and empowering unmedicated birth experience in the hospital? Yes, you can. We've talked in the past, though, on different podcasts about what Rebecca Decker from Evidence-Based Birth calls the golden ticket. In order for that to happen, you have to have the golden ticket. You know, all the stars have to align with the right nurse and the right provider on call, and you know everything, right? But you can. If you're planning an unmedicated birth or attempting an unmedicated birth at a hospital, you really want to actually look at not just their C-section rate, but their epidural rate. And the reason for that is not because I'm anti-epidural. I'm not. 2 out of my 3 deliveries had an epidural. I'm eternally grateful for the first one because of, you know, my back labor we tried everything, and that was the last thing we could try. But it's not because. It's because when you work at a hospital as a nurse that has a 80% epidural rate, like one of the hospitals that I worked at, unless you as the nurse have gone out of your way to train with midwives and doulas and take workshops to learn natural childbirth support, or you have other experience as a doula or as a nurse at another hospital where people generally go unmedicated, you probably have never seen an unmedicated birth other than what we call a drive-by, which is when like a second time mom comes rearing in with the one cheek sneak, right? And the baby like comes out. And those are not the same thing as an unmedicated first delivery. They're just not. Because many times those people are not expecting to give birth naturally. Okay. And so they are coming in and the head is crowning. And so I don't want to say they're out of control because that sounds negative, but like they're kind of, they did not expect this to be so fast. Their first labor was not this fast. And now, I mean, people say, oh, you're so lucky you had a 3-hour labor. I disagree. Like if somebody has a precipitous labor like that, it is often the intensity of a 24-hour labor in 3 hours, right? So like that's a pretty big deal. So these people are kind of like climbing up the bed, like this baby's coming out. Oh my God, they can't even, it's happening so fast, they can't even wrap their head around it, right? And so if you work at a hospital as a doctor or as a nurse, where the only unmedicated births you see are these precipitous multiparous deliveries, you have no idea what unmedicated birth in the long run looks like. And therefore, and almost all of the time, I can't, but almost all the time, that freaks people out. And so what do they do? I had a very, very good friend actually who worked at a big tertiary care center in Boston and was coming to a hospital that I worked at. I had a very high midwife population. Over 40% of the babies were caught by midwives. There was a 50% natural birth rate, whatnot. And she was coming to work per diem there with me. And she was like, when I see people in pain, I just don't know what to do. And I feel so bad. And I just want them to get an epidural so they'll stop making noise, and like, it wasn't that she was a bad person. She was like one of the most compassionate, skilled nurses that I've ever had the pleasure of working with. She just didn't have any tools in her toolbox as the nurse. She had never really seen people go unmedicated, and therefore it terrified her, right? So, the people around you, you don't want them to be scared. If you're screaming, I'm gonna die, you want that nurse or that doctor, that midwife to say, no, you're not. Like not to say, oh crap, you should get an epidural. That's not your plan.
Or to say, shh, you're going to scare other people down the hall.
Exactly. And I've heard, quiet down, or you're out of control. Like, no, I wasn't out of control when I was screaming, I'm gonna die. I felt like a great thing was coming through my body. I was completely in control. It was intense, And I also agree with you, Dina, about like sometimes. Because, okay, so even though and I'd love to hear your experiences, even though my unmedicated delivery with Marceline was intense, like looking back on it, I am so grateful that I had that experience of like just how powerful humans can be, right? Like it was just such a life-changing like experience. It's still positive and empowering for me, even though it hurt. Right? It hurt at the end, like hell. So I feel like people in the natural birth world don't want to admit that though, that sometimes it hurts like hell, because then it would be like bad mouthing unmedicated birth, and people aren't going to want to do that. But we have to be real about it, right? Because otherwise, like you're saying, Dina, and people feel badly about experiencing discomfort. People feel badly about yelling. People feel badly about saying whatever they need to say to cope, right? Can you talk a little bit about that?
Yeah, I mean, I think that we've also equated childbirth and your body opening and letting a baby come out, even though it is for most people painful, that our bodies are meant to do this, right? Like we're mammals, right? Our bodies know how to do this. Women have been doing this forever. And we've sort of stripped women of that belief in themselves. And I'm not saying that there's not a time and a place for epidurals, because there absolutely is. Or any medical intervention. I'm super happy we have lovely hospitals. I'm super happy that we have all that. But women have been told over and over and over again their whole lives that this is scary and awful and you can't do it. That you can't do it. And it really, I feel like it takes away the power that women have. I feel like we've just been told our bodies can't do it. We've just been told repeatedly our bodies can't do it.
And some of
Sorry.
Some of the births that you attend are very long. And I think
Mm-hmm.
so many people in our culture think, well, I mean, if it's more than 12 or 16 hours, I'm going to definitely get medication, when we all know that there are people that have had 70-hour labors, and including those who all 70 hours seem to be very, very hard compared to those who have, 55 hours of easy labor that they count as part of the 70. So when you're witnessing that as a midwife and you're in their home for hours and hours and hours, and making sure that you feel present and calm, because this is not a problem, it's a very different experience, right? So what are some of the things that you find are helpful to kind of talk about how that physical piece of, and emotional, as we drift into emotional, of that length of labor?
Nice segue.
Yeah.
Yeah. How do you as a home birth midwife support that physical journey, especially when it's long and
That gets
more
emotional.
challenging?
Mm-hmm. So I actually really love doulas. I think that doulas have a huge place at home births, that they're not utilized at home births enough. I think, midwifery, the role of a midwife is very different than the role of a doula, right? So, like, a doula is there specifically for physical, emotional support, right? I'm there to make sure clinical things are good, all of those extra things. And I need to be awake and present when your baby comes out, right? I need to be really on. So I can't let myself get depleted. I just don't. So whether you have your best friend, whether you have your mom, whether you have, someone there, I think it's really important, especially with the first baby. I think with a second or subsequent baby, you have a better idea of what that feels like and what you might need, right? And some people are like, no, I'm good. I don't need that. And they don't. So I think from a midwifery standpoint, I do a lot of, like, I'll come and check in on you in the morning, and I'll come and check in on you in the evening. I'll come and check in on the baby, make sure everybody's, doing well. It doesn't behoove you for me to sit and stare at you for 72 hours. So it makes you feel self-conscious. Now, if it depends on where you're at too, right? It depends. I guess it's hard to generalize again, because I have been at births for 72 hours as I'm sitting here talking and thinking about it. I think that for women, that knowledge piece is really important. I think most first labors take a really long time. I think most natural first labors take 24 to 48 hours, if not longer.
Absolutely.
You may have days of, start and stop, or 10-minute apart contractions, or 5-minute apart contractions that aren't moving anywhere and they're just kind of hanging out, those kind of things. So I think that the piece of knowledge about what to expect is super important, and how we're going to manage that, right? It's nutrition, rest, peeing, all of those things, alternating walking with sleep, right? If it's dark out, try to sleep. If it's light out, try to do your day, right? Ignore it. I think people pay attention to the early stuff, and I think they get exhausted.
But I think too, like, one of the good things about a good childbirth class is that the partners of the birthing person are also learning what's normal and what should they be doing, and what should they be reminding the birthing person to do, because sometimes it's the partner or the grandmother, who's like, shouldn't we be going faster? Shouldn't you be pushing by now? Shouldn't you be going to the hospital now? Shouldn't you be, and trying to rush it, versus stepping back and saying, this is normal. I love that you are checking in and stopping by. And I wish that we had that for people who were, I wish that happened for everybody that was giving birth in a hospital, that somebody could come to their home first and check on them. But we do, doulas, right? To be able to engage with that doula on the phone or even in person, to be like, let me come and tuck you in, let me make sure you have a good meal. All right, let's do some techniques, and then you can take a shower and then call me later. Those are the kinds of things that give you that emotional support, even though you're not there as a midwife or a doula the whole time. they know somebody's there. I can reach out for them in a moment. I can get
Absolutely.
reassurance. I can find out what's going on. And for the partner too, or the grandmother or the best friend that's with them, whoever, you're like, is this normal? You know, I remember as a doula seeing that all the time where partners would look at me and be like, is this normal? You know, you know, or
Actually, my husband did that. My husband said that. So there's a scene in the bathroom at my house
right.
back in 2012 where I am in the tub, right? I'm like on my hands and knees, like my whole body's like convulsing, right? And Jeanette is pouring water. Oh no, my mom was pouring water on my back. Jeanette was stroking my hair and telling me how I was amazing and beautiful and doing such a good job. My body was opening, right? And Paul said that I was kind of like bearing down. And he was like, holy crap, this baby's coming out in the top, right? Like, this is going to happen. And he was panicking until he looked at Jeanette and my mom, who were totally calm, right? Jeanette was my doula for those who haven't listened to other podcasts. But, and he was like, oh, I guess if they're not panicked, I'm fine. You know, like you don't understand like how he still talks about that, like how that reassurance that he didn't need to freak out, how important that was to him, you know, to have that. And that doula support, it's everybody deserves a doula for sure. And so that's a great segue, like you said, into the emotional. You know, I often say in childbirth class that labor is as much an emotional challenge as it is a physical challenge, right? I actually, side note, Jeanette, used to describe labor as a marathon until I actually worked in Cambridge where everybody actually runs marathons. And then they're like, what is that marathon? I'll run that marathon. I'll train for that marathon. I will do that marathon. I was like, wait a second. I don't know. It's not exactly.
Yeah.
So, but no, it is as much a emotional challenge as it is a physical challenge. And that the emotional preparation for labor and birth is as important as eating well and exercising and going to prenatal appointments and taking care of your physical health, right? Getting emotional. And we talked a little bit about this in our episode, I don't remember the number, but with Justine Leach from Resilient Birth. But why do you describe labor as an emotional journey? What does that mean to you?
And again, it's different for everyone. I'm just in the super lucky profession that I adore, where I get to know you really personally and your partner and sometimes grandma and your children. So I can tailor things specifically to you. But for most women, we bring stuff to birth, right? We bring all of our experiences to birth, right? This is you know, the emotional and spiritual kind of connect in for me at this point, right? So you bring all of your experiences, all of your guilt, shame, worry, your relationship with your mom, any past abuse, your worry about what your vagina is going to look like, your, you know, all of it. You bring it all into this experience. And so working through layers of unfolding that is really important so that you can feel like you're capable of moving forward and doing this amazing thing. And I think women, again, are told they can't. They're just straight up told they can't, but they're also told all the way along by our culture, the TV shows that we watch, all of it, that they can't do this, you know, that it's going to be too big. And I frequently say things like, this isn't bigger than you because it is you, right? This isn't more powerful than you because it is you, right? So I feel like women are needing to be reassured that this is safe, right? This is what your body knows how to do, that you're going to be surrounded by people who care about you and love you. It's an easier process at home, obviously, to create that space. But I love playing with the word space, because what does space mean, right? Do we create space for people, or is that space already there and we just open the door, right? We just go, here's your space. You have this space. It's yours. We don't, and I'm toying with the holding space thing. I don't really like it anymore.
Yeah.
I feel like holding someone in a space doesn't allow for the expansion of that space, right? So you're holding this container for them, but you're not allowing for that to happen. So it's an interesting play on words I've been playing with. But emotionally, I think you need to feel safe You need to voice all of your worries and concerns, right? A lot of what I do in my office visits, it's not therapy. I know my boundaries, and I'm a huge fan of therapy. Like, I would love it if everybody went to therapy. Everyone.
Me too. You're here.
But we talk about how are you doing emotionally, right? So my visits are like an hour because there's 15 minutes of listening to your baby, measuring your belly, doing all the vital signs stuff. And then there's 45 minutes of what's going on for you. You know, how are you feeling? Not just about this pregnancy, but about your life. You know, things are going on for people all the time, and it really plays into this experience for people. People voicing things like, I don't want to reach down and catch my baby, right? I don't feel connected, or voicing all the things that you're afraid about help remove all these barriers to this process. So a lot of what we do is emotional work as midwives, I think.
Something
Or at least I do.
something I just thought of while you were saying that. People who have never had anybody who's a care provider ask them these questions, sometimes I will hear them say, oh, I don't need that. I just want somebody to get in there, tell me my baby's okay, listen to heartbeat, measure me, wham bam, let me go. And while that could be true, you're also saying you don't need something that you have no idea what it is. Right? So I could see people thinking, oh, that's going to be such a pain if I want a home birth or even a birth center birth, or even I got to talk to her, I got to get emotional. Like, you don't have to, but you may be surprised at yourself that when someone actually really seems to care about you and wants to ask you how you're doing, that you can start talking about it. And it doesn't have to be in this woo-woo kind of way, or revealing all of your deepest, darkest secrets and fears and pains of your life. But to have that person, like you're saying, create a moment, a space where you are asked to fill that, may actually be way better than you ever thought. And that's also why therapy is a good thing. Again, not that you're providing therapy, but you know, I remember going to therapy and it was very awkward, like that moment, you know, where therapists are supposed to be so quiet and they're supposed to be really quiet and still quiet and like wait. And you're like, can you just say something? And they're like, I'm waiting for you. You know, you're like, you know, okay, I'm paying her to listen. I guess I should say something, you know, but just checking in with a person and be like, what are you worried about? And you could be like, yeah, I'm kind of frustrated because this happened, or I'm excited about this, or this made me rethink how I'm feeling about this pregnancy or this birth. And whether you're having a home birth or not, having somebody in your life that you can have these conversations with is powerful.
And I think not all women have a lot of stuff to talk to me about. Sometimes our appointments are like half an hour. You know, it's pretty quick and people are like, I'm actually good, you know, and that's totally fine. It's more about having that ability to have that there.
Absolutely. Because even the most well-meaning, I've worked with some incredibly compassionate, evidence-based, holistic OBGYNs. When I worked as an office nurse, I worked with some of the most incredible OBs that I've ever had the privilege to know. They were tied to a 15-minute schedule. Like, it's like, in fact, one of the OBs that I shared an office with that was like just wonderful. She herself, when she was pregnant, got midwifery care. Even though she was an OB, but she was an OB for a lot of different reasons, not just catching babies, but because she liked gynecological surgery and all the other things that OBs can do, right? But she did not, like, it wasn't a competition to her, that like OBs versus midwives. She was like, it was completely different. Why would I go see another OB who does vaginal hysterectomies and removes fibroids as their specialty when what I really want to talk about is how am I going to love the second baby, because I don't know if I can. And we all have that feeling, you know, like, you know, when you're becoming a parent, like, am I going to have enough love in my heart? You know, those kinds of things. And she would have been she was an OB, she was a DO, as opposed to an MD. So her training was a little bit different in some ways, but you know, she would have loved to have those types of conversations with her patients, but she was tied to a 15-minute schedule, you know. So, and I don't know about you, Dina, but so I work for a home birth practice now, and the midwives that I work with, Rachel and Marianne, they start off the conversation not with "Tell me about your deepest, darkest fear." Right? Like, that's not what they do. What they do is they're like, "What did you eat yesterday? How long did you sleep last night? those types of questions for a pregnant or a postpartum person can tell you a lot. Because often from those types of questions, we get, actually, I haven't been sleeping. These riots and protests have been keeping me up at night. I'm concerned about my family's safety. Or, I haven't been eating. I haven't had an appetite because I'm just so stressed with the other kids. And I feel guilty about not cherishing this pregnancy as much as I did my first, or whatever, right? Like, we're not sitting there being like, let's be super awkward about like everything in your personal life. Like, that's, when you like create space. I like what you said, Jeanette, create the space to talk about those things and see what comes out of it. It can be really powerful. It can be a really powerful exercise. In fact, one of the only book that I reread, because I've read 100 million I'm a birth junkie through and through. The only book I reread for my second and third pregnancies was Birthing from Within by Pam England, which was, it's all about the emotional journey. And I have to mention something about you, Dina, specifically, because my first labor, like I've mentioned, was incredibly long and difficult back labor. I felt like my body was cracking in half during every contraction. And poor Jeanette, arms must have been, so tired from all those those hip squeezes and counter pressure and whatnot. So when I got pregnant with my second, I posted on Facebook to my friends, what can be some of my mantras? I'm trying to think positive. I'm afraid about, having the same experience. And so people were like, how about different body, or different baby, different birth? Or how about, whatever. And they were all doing all these positive things about how it was going to be so different this time around. And you, specifically, Dina, I don't think you remember this, but you said, I'm going to be the devil's advocate here and say, what if it's exactly the same, Melissa? What if it is even worse? What if instead of 36 hours of labor, you have 56 hours of labor, and it's bone crunching and it's terrible and you're having diarrhea and you feel like you're just going to break in half? How about your mantra is, I've done it before, I can do it again. Labor didn't break me before, it's not going to break me again. And that completely changed my whole outlook. I can't tell you how powerful it was to hear you say that. It's been 4 years. But just being like, you really made me think, like, I can't avoid this. It could be exactly the same. Spoiler alert, it wasn't. It was totally different in a better way. But it could be exactly the same. But you know what? I can do it because I've done it. It didn't break me. Like you said, it can't be more powerful than you because it is you, right? So it is so much. That was a huge emotional journey for me. A lot of people who are having VBACs have the same type of experience, right? Like not wanting to repeat the first birth experience and holding on to that labor as they go through their second pregnancy, So a lot of preparing for labor and birth is an emotional preparation.
Mm-hmm.
Along the same lines,
Yes,
just
absolutely.
of what you said, Dina, about like, it is you, this is powerful and it is you. And wording it slightly differently, the way that I heard that years ago was that when you feel a contraction, a surge, a wave, whatever you want to call that feeling, where you feel that intensity that comes on in labor every several minutes when you're really deep into labor, that feeling you feel is your own strength. And that really struck a chord with me. I probably learned, like, had somebody say that to me after I had my first baby. So I remember, thinking when I was having my second of like, it's almost like you can be real, like, flippant and sarcastic about it, which is more my style. And I'd be like, holy crap, I'm so strong. Like, that one really hurt. I must have a lot of strength in there, But like twisting things to be your, like, all right.
Yes, absolutely.
I'm going to put you guys on the spot a little bit. Do you have any stories that stick out to you of clients you've taken care of in the past, of course, not using any names, of an emotional release that they had to make in labor in order to give birth? Because this is something that I've seen many, many, many times, that labor seems to be stalled and we can't figure out why until there's this emotional release. I don't, either one. Do you have anything else?
So I feel a couple of ways about that. I feel like women put a lot of pressure on themselves to feel a certain way or not feel a certain way. And so I caution people not to get caught up in like, if I'm not in the perfect mindset, right? if I have any fear, if I'm feeling any certain way, or there's anything that's blocking it, that I'm causing my body to not work well, right? So on the flip side of that, yes, there are things that you can do, right? So yeah, I have it happen all the time. I mean, I think that, but it's tricky. I think that's a tricky one because I, again, feel like women blame themselves for so many things that I don't want to add another layer of that to that. But I have seen women, especially women who have had a traumatic first birth, during their second birth. So if someone has a posterior, very long, very painful first birth, there's many, many times during their second labor that they pop out of what I call labor land and start going into thinking. And they start saying, oh my gosh, this is the same thing. This is the same thing. This is going to happen again, right? And it slows everything down, right? And so when they can get back to that space of not thinking clinically, logically, and get back into their body space and their brain space, out of their brain space, their labor starts to pick up. And that happens all the time.
I think that's true. This isn't a black and white situation. I'm glad you said that, because when we give this type of advice or guidance about, like, facing your fears, it's not that you're going to go into labor and birth with no fear. And that's impossible. Mm-hmm. As Kim England says, worry is the work of motherhood in a way, right? Like, I mean, if we didn't have worry, if we didn't have fear, we wouldn't be diligent. We wouldn't be, that's not realistic. You might still come into your labor and birth experience with worry and fear, but you still got to do the work. You still got to face it in some way, shape, or form, and instead of just walling it off, right? Instead of just walling it off and not thinking about it, because it's going to come back. So even if you haven't worked through it entirely, there's no right or wrong way to give birth. But even if you haven't worked through it entirely, it's not impossible to give birth without doing emotional work beforehand. But there's something to be said for at least giving it a shot. There's something to be said for talking it out. There's something to be said for brainstorming with somebody that can be compassionate, a compassionate listener, right? Even if you don't come up with any answers, right? Like, if you're worried about, am I going to be able to provide for this baby, right? In whatever way, emotionally, physically, financially, we might not have any answers for you, but at least you've like said it out loud, right? At least you've like allowed yourself to think about it. And it does take away some of the power when you allow yourself to say it out loud and think about it. I feel so. Maybe I'm in the minority.
Yeah, I mean, I tend to work with a lot of women that have trauma in their past. And I think because many women have trauma in their past, I think it's just a numbers game. And I think I've watched women who have had some of the most severe abuse birth their babies in 2 hours. Terrified. And I think that the most important thing is that you feel safe with the people that you're with, that you feel heard if you want to talk about anything. But again, I don't actually know most of those women's stories. So it's not that we're sitting there and talking about your story.
Exactly. I agree completely. Yes.
Because that's not necessary for me to know. But it is necessary for me and you to have a deep trust and understanding for you to move through that. So it's not that you need to resolve everything, I guess is my point too. So, I see it, I see it in all different ways. I see it in all different ways.
What about you, Jeanette? What, any personal experiences as a doula?
Definitely. But I mean, I do love what you said, Dina. Like, we can't make it their fault. We don't know. And that's the hard thing. I mean, you can talk about anything in life where, well, if I had just done that, or if I just thought this differently, then this would have gone differently. You don't know that. There's so many factors that go into how your birth goes. However, when you're so focused, and people in labor have admitted this, that they felt so focused on one particular thing, which had nothing to do with right now, that when they kind of got alerted to the fact by someone simply saying, what are you thinking about right now? Whether they answer the question or not, they can be like, oh, I'm thinking about how challenging it's going to be to bring a baby into this marriage that I don't feel very safe in, but I could deal with that later. So how about I focus on having a baby right now? Not in so many words, but in retrospect, the conversation was had. Or I remember a funny one which was this couple. They're so sweet, and they had such an amazing playlist that they had one for early labor and one for active labor and one for transition and one for pushing. And I remember spending hours and hours. I was like more of an early doula where I was spending more time with people when they weren't really in that much of a labor. So I probably shouldn't have been there, but that was a great lesson for me. And it was almost like they had picked the song so perfectly. I remember listening to words because I love to listen to words of songs. And I'm like, oh my gosh, this one is so perfect for this situation. This is so great. It's about this future child you're going to have. And, the words to the songs were so well played. So later after, a couple of weeks, I saw them later after they had the baby, after very, 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 very long labor. And I said, can I get a copy of the playlist? Like, those were some really amazing songs. And she goes, yeah, but I was thinking about it. I wonder if my labor was so long because psychologically I wanted to hear every song.
That's funny.
like it doesn't always have to be I'm thinking of a traumatic experience in my life, or I'm worried about my previous labor, or I'm worried about my marriage, or can I love another baby? Sometimes it's so simple, or people are like saying, oh my gosh, like every time my partner spoke to me, all I could smell was coffee breath, and it was driving me insane.
Yeah.
And like they feel like they couldn't relax because they were like debating, do I say something and make them mad?
So true.
Right? So sometimes it's these like really practical things that are not so in depth. And honestly, like you said, Dina, like people don't always have to share their story with you as a provider or with their doula, but sometimes some people are fortunate and they don't have major traumas in their life, or they've already worked through that trauma or worked through that issue that they had, and things are fine right now. They're excited for this baby to come, but then something else can get in your emotions during that laboring process that can slow you down, because we think maybe they're slowing you down because you're thinking about that thing, even if it's silly.
Childbirth tasks will help you learn how to really stack the cards in your favor for setting the mood. Right? So that hopefully a lot of those things don't come to fruition, because setting the mood for labor and nurturing that environment for you, so that, that brings us to the spiritual, the last part of our discussion. The first page of your website, Dina, says, I believe birth is an empowering, sacred, life-altering experience. And any parent will tell you that having children has been life-changing for sure. I mean, your pre-kid life is not going to look like your post-kid life, no matter what you say. Anybody on this podcast watching this video, if you think that things are not going to change after you have a baby, it's all going to be the same routine. It's just not. Because you're now responsible for the physical caring and well-being of your children, right? But it's so much more than that. And one way to become a parent, we've been talking about labor and birth because we are childbirth educators and midwives. Not everybody becomes a parent through labor and birth, but that is one way to do so. And you describe this experience as a sacred spiritual journey. Can you talk more about this?
Sure. So I think that not for everyone, again, right? This isn't that experience for everyone. Some people are super practical. I've had people who are like, that's not my thing. I'm just going to have the baby. I don't really need any of that. And I'm like, great, that's perfect. That is totally fine. But for a lot of people, it is a deeper journey, because you, for a lot of people, feel as though whatever your spiritual affiliation is, it doesn't matter what it is, right? It doesn't matter what you believe. It doesn't matter if you believe in the universe or spirit or God or Jesus or Islam. It doesn't matter what you believe. There is a piece of you that feels as though, or at least I sort of see women actually doing this, or birthing people doing this, leaving this state of being, right? Like there's this space where we all exist on, right? This plane of existence here on Earth, right? We walk around and we do our mundane things. But then there's this other space that women go to a lot in labor. And I don't know what that spiritual space is for you, or for, and again, we don't even need to talk about it very much, but I can watch it happen. And you go and then you bring a being into your body, right? Like a whole person, like whether you call that a soul or a being in, and then you grow that person, right? So you're connected to this person for a long time while they grow. And then you push them out of your body into this world. And then they're separate from you again. So you go from being one being to two to one again. That is not even looked at anymore. Like, we don't even look at that as anything. And I think we're so focused on babies, right? We live in a culture that's very result oriented. So we want the results, right? So the baby gets a lot of focus. But the mom's journey through this doesn't really get looked at very much. And I think for a lot of people that feels empty, or they're left not understanding what just happened. You know, we used to have rituals, right? We used to have, you become a man when you go out on your vision quest, or you have a bar mitzvah, or you know, there are things that we get married, right? There are things that we do to commemorate movement and ritualistic, you know, achievements to the next level, whatever you want. I have a whole bunch of boys play video games. So I think that we're missing that piece. You know, I love the Pam England stuff, and she has a book called The Labyrinth of Birth now, right? This journey that we take when we go through this process. And I think that's really special. And like you were saying, you can't go back. So there's all this focus on, right? You're going to have your baby, and then you're going to get your life back, right? You're going to make your life the same as it was before you had this baby. That's the goal, right? We're going to get our bodies back. We're going to get our relationship with our partners back, you know, and we're going to never change a thing about us, right? This baby is not going to change a thing about us. And that's not how it happens. All birthing people worry about that baby from the moment that it comes out of you, right? You just can't not, you know, it just changes who you are as a person. And I think we don't even pay attention to that. And I think it's really doing women a disservice, you know. And again, not everybody feels like that, and that's fine, you know, but I think a lot of women do. A lot of women go, what just happened? That's crazy. And then they sort of don't know how to put words to that experience.
And do you feel like you've observed the spiritual side as a doula as well, or more so in a home birth environment?
I feel like it's easier at home to do all of that. I feel like it's easier to create a safe enough space, right? So when you're in your home with people that you know at your birth, right? You have appointments with me and you know I'm coming, right? You feel safer to read from the Bible, or, you know, you feel safer to say prayers. You feel safer to burn sage, right? Whatever it is that you do, right? You can do your thing in your space. And usually we've already talked about that. Like, you can do your thing in your space, whatever you want to do is fine. And we will join in. Like, I'm good with whatever it is that I can be helpful to facilitate that for you. And so I think I haven't really seen that in the hospital. I think it's harder to do. I think it's just harder to do. Just as women will reach down, right, and hold my right labia, right? They feel safe to do that at home. And in a hospital setting, you usually, when your baby's coming out, you have a room full of people and there's lights, and most of the time you're on your back. And there's it's busy. You know, on a home birth, it stays pretty quiet. It's pretty low key, and you feel pretty comfortable to do your thing. So I think it's more likely to happen at home.
Yeah, I think I've seen some spiritual things done in hospitals. I'd be curious. I know at least one time, there was a couple where they really wanted to read a certain prayer that the father was supposed to read as part of their culture after the baby was born, and it was beautiful.
That's gorgeous.
And related to holding onto the labia, which isn't quite as spiritual, but just practical. There was a moment where a mom turned to me during pushing, and she had read that touching your clitoris during pushing could be helpful. And so it was such a cute moment. She turned to look at me because I was on her side, and she said, "Jeanette, should I play with my clit now?" Like, whatever you want to do, but but then one couple was singing show tunes because they both had been in musicals and that was one of their passions. And then the midwife came in and she knew some of the songs. And so she started singing and I was like, what a great show I'm getting, because I don't do that. And actually, I think the same mom, actually a different labor, was telling jokes, and she was probably 8 centimeters, but she's standing up, rocking back and forth, telling jokes, which in a way is like a fun other way. You could call that spirituality, right? But I don't know. But it doesn't always have to be a prayer,
Nope. I mean, we did a lot of dancing to 50 Cent at one birth, whatever it is that makes you feel connected, I'm trying to think of some other funny ones. I'm sure there's a whole bunch of them that are just sort of slipping my mind, but that's a pretty good one. We still joke about that. There was one where I said, that's the way a lot to her. That's the way to do it. And so every time she hears that song, that's the way, the case. Text me. Like, it's been a lot of years and she'll still text me. I'm in the grocery store and then that song came on.
I love that because that was my very first favorite song and my very first album that my dad ever bought me.
That's so funny. Yeah, so it's not always, this big, deal. But I think there needs to be at least a space for that, right? Space for acknowledging this huge process you're going through in whatever way that makes you happy to go through that process, I just think we just ignore it all. I just think we don't pay attention to women's emotional and spiritual well-being. We're really focused on the baby and we're really focused on just the physical aspect of birth.
People ask, Melissa, I'm curious for you too. People ask doulas, why do you, like, we ask each other at least. I don't know that parents have ever asked me this, but I guess some have. Like, oh, do you do this because you love babies so much? And, I know that's a conversation I've had with many other doulas back in the day. Why do you do this? Is it because you get to see all the babies? Or even as a lactation consultant now, is it because you get to see all the babies? And I was like, no, it's because of the parents. It's like watching them grow, watching them learn, watching them get to know their baby and connecting with their baby and going, oh my gosh, I can do this, or I can make this decision, this hard decision, and I can do the work, or I can make the right decisions for me to not do the work or do the work, whichever. It's really cool to watch that and to see them grow in confidence over the time that I get to know them.
Yeah. Oh, absolutely. I mean, it is just a full disclosure. I love babies. My grandmother and I are very similar she's 86 years old and she rocks babies at a local church. They have a daycare in the church. Not now because of the pandemic, but she goes and rocks the baby at nap time because she's just loves babies. And I got that from her. I love babies. I love smelling babies. I love holding babies. I love when they just flop their whole body like silly putty into you. But I'm not a labor and delivery nurse or an OB nurse or a visiting home birth nurse for the babies. They're just an added bonus. I love working with the birthing people. I love working with people that are creating life inside of them. I love working with, like you said, teaching people, helping them become empowered to make decisions that work best for their body and their baby and their birth, and guiding people through that journey of 2 to 3, right, or 2 to 4 if you're having twins. I love that. Babies are an added bonus for me, but I don't do OB because I love babies. I do it because I love moms and dads. I love working with them so much. And the babies are just an added bonus for me.
Yeah.
What about you, Dina?
My favorite age is teenagers. I love teenagers. So babies they're adorable. Their heads smell better than anything on this entire planet. But I really feel like the babies are good. For the most part, babies are doing okay. And I think that the parents are not. I think there's a lack of support. I think there's a lack of attention paid to them. The idea that people are not seen when they leave the hospital for 2 to 6 weeks. So much happens in that postpartum period. And even just telling people your baby best, right? You can read all the books, right? And then put them down. then put them down. And what do you feel like in your heart is the right thing for you? Because that's different for everybody and every baby. And you grew this person, right? You know this baby better than anyone in the world. And watching parents sort of move into that, just like they do with birth, right?
Awesome, Dina. So one more idea is, what things would you suggest for those listening to optimize their experience of birth from a physical, emotional, and spiritual aspect?
Compile a really great birth team of people that you trust, in a place that you trust, wherever you feel the safest, and whoever you feel safest with. I think that is the biggest thing. It's key. Hard to create that space without it's hard to move through those things when you don't feel like you're safe.
Melissa, you were going to say something.
No, I second that. I feel like you have to give birth where you feel safe, and you have to give birth with people that make you feel safe. And so, as you're building your birth team, you don't owe your birth to anybody at all. It's your birth. And so if your mother or your mother-in-law, your sister, your best friend is pressuring you into being there, if they don't make you feel uninhibited and relaxed and feeling like you can be and say and do whatever you need to do, they shouldn't be there. You don't owe your birth to anybody. I hope, and it should be all about you and what makes you feel safe and comfortable, because you have to get to that primal part of your brain to birth, because we're very sophisticated mammals, but we're mammals nonetheless. And so you don't owe that experience to anybody, and you only get to give birth to this baby one time. Even if you have 100 million babies, you only get to give birth to this baby one time. So yeah, I agree with Dina, building your birth team. And I know it comes up every time. It's almost like we're prompting people, right, Jeanette, to consider getting a doula. Because whether you're having your baby in a birth center or at home or at a hospital, I feel like doulas are ideal people to provide physical, emotional, and spiritual support to you throughout the labor and birth process.
Can I say one more thing?
Absolutely.
I think a piece that's missing is that we tend to forget that the baby's actively participating in this process too, right? So I think as women, we can work on creating our birth team. We can take all the classes, right? We can meet with an IBCLC. We can cover all of our bases. We can do spinning babies. We can do all of the things. And then this baby has the other part of this. Mm-hmm. So it's not all on us, this process and how it unfolds, right? So the baby has its story. The baby has that journey. That's a whole nother podcast we could do. But I feel like, there are two beings working together for this, right? So we can't forget that in this whole piece of this too. They have their story, and sometimes their story is to come out, a C-section, and sometimes their story is to turn posterior, and sometimes their story is to tuck their chin and come out in 5 minutes, So I think, again, I do hate to put all of this on mom or birthing person, because I feel like we have to do our part, but the baby's the other part of that.
Yeah, I like to say our job is to facilitate that as much as we can. Yeah. Awesome. Well, we could go on. We always can talk about all of these topics so many hours, but we don't have that much. But thank you so much for being here and saying yes and telling us your perspective and your stories. It's awesome. You had also, we've talked about the videos that are out there, but Why Not Home is a video that is helpful. Yeah,
absolutely.
That one's a good one. So if you want to learn more about Dina's home birth midwifery services, you can go to centralmassmidwifery.com, and you work with another midwife as a team, and sometimes others as well if needed. And we hope anyone listening will go to babiesincommon.com/show and see what we have coming up soon, and also watch the other episodes that we've had in addition to this one, and learn so much and share them with your friends and family. So
absolutely. And if you've learned even one tiny morsel of helpful information today, don't be stingy. Please text a friend who's either expecting or parenting and tell them about us. And if you want to laugh your maternity stretch pants off while learning about childbirth, babies, and breastfeeding, please consider taking a live and interactive Zoom class with us, or tell your friends about Babies in Common. Virtual lactation and feeding consultations and a weekly feeding group called Breast Milk and Conversation is also available. And if you follow us on social media, we are always posting great articles, videos, and resources to help you rock your birth and thrive as a new parent.
Awesome. Our next video will come out after the 25th of June. We'll be talking with someone who did extended nursing, so to speak, with her first child and then tandem nursed both of her children for a while as well, and that experience. And we hope you'll check that out. So we are a community for you. After all, we all have babies in common. Thank you, Dina.
Thank you, Dina.